Assalamu alaikum, dear participants. This is your host Umair Farooq, and I, on the behalf of Being Mentor, welcome you all in this webinar. Hopefully, you all will be in good state of your mind and your health. The topic of this webinar is rabies and its prevention, and it will merely take less than half an hour to conclude it. So stick with us till end and attend the lecture with your all of your nerves and attention, as it will cover some part of final quiz. Before actual start of this webinar, I have few instructions for all participants to mention here. First of all, listen the lecture carefully. Please switch off your video cameras and during whole webinar. This webinar, please use only chat box. You will be answered at the end of this webinar in question and answer session. Now, let me introduce you with our guest speaker. Today, we have the most respected intellectual man with matchless courage and personality, our distinguished guest speaker, Honorable Dr. Muhammad Farooq. Dr. Muhammad Farooq is a DVM gold medalist from one of the top most veterinary universities in Pakistan named UVAS Lahore. He has done his PhD from University of Rennes, France. Currently, he is serving as an assistant professor in College of Veterinary and Animal Sciences, Chang. And I personally am blessed having him as my mentor. Now, I would welcome Sir Farooq on behalf of whole team of Being Mentor, and I'll request Sir Farooq to take me over and let's start today's lecture, please.
Assalamu alaikum. Thanks for introducing me. Can you listen my voice? Is someone
Yes,
can
sir.
confirm?
Yes, sir.
Okay. So
Yes,
I'm
sir.
sharing my
Aap
screen. So now normally you can see my screen.
Yes, sir, we can see.
Okay. So I want. So today I am going to talk about rabies, which is most fatal disease because the case fatality rate in rabies is 100%. That means everyone who shows symptoms of rabies will eventually die. And it is also called as the most neglected disease, the most neglected viral zoonotic disease. So today we are going to discuss about the current status and future control strategies about rabies. So here you can see the monogram by WHO. They say that 0 by 30, that's the slogan raised by WHO. What does it mean actually? Actually, WHO says that we are trying our best to nullify the deaths caused by rabies in human till 2030. So that's the slogan of WHO on which they are working at this moment. So today we will talk little bit about introduction and its epidemiology and what is the status in world and Pakistan. And we will discuss little bit about the initiatives being taken in Pakistan and some strategies to control rabies. So rabies, as you all know, that it's a viral disease. I imagine that all of you have already read about rabies. I imagine that you are normally the veterinarian students who are participating in this webinar. So I will focus more on the control of this disease. Okay. So here, this was the image shared by the WHO on World Rabies Day, which is celebrated on 28th September. So here you can see that that rabies is caused by dogs, canines, and some wild animals and bats. So, but in most of the cases, in about 99% cases of rabies, that is associated with dog bites. So it means if we can break this cycle, we can control 99% cases of rabies. And you can see the importance of this disease, that it is causing one death in every 15 minutes globally. Sorry, I have a disruption here. If you see, the because the children are more susceptible to dog bites, that is why you can see that the case fatality in children, it is 4 out of 10 deaths are inflicted in children. So that means it causes the most the wastage of life years. And here it is the image. Now you can see there are some endemic countries, in particularly in Asia and Africa. And what the WHO says, we want this world which is free of rabies. It's free of rabies inflicted deaths. The bad news is that once you are infected with rabies and you started to show the sign, the chances of survival is zero. But the good news is, if you take the vaccination in time, the post exposure prophylaxis in time, this disease can be prevented in almost all individuals. It is 100% preventable disease. What you have to do is, we need to vaccinate the individuals and the animals to stop the transmission of rabies. And we need to educate the people how to react with the particularly dogs. If you see the little bit about pathogenesis of rabies, when the virus enters in the body, it is through dog bites. Normally, the virus cannot enter in intact skin. Once our first barrier, which is skin, is broken, is disrupted, then the virus can enter by the bite of rabid dog or rabies infected dog. And then virus starts to multiply there and then travels to the brain through nerves, and after that it again multiply in through neurons, and it travels back to different tissues through the nervous system. One important thing to note here is that when the dog bite is far from the brain, the incubation period is longer. If the bite is near to the brain, then the incubation period is shorter as compared to when the dog bite is far from the brain. So that means it actually takes times for the virus to reach to the brain. Once it reaches the brain, it starts to produce different clinical manifestations of the disease. So there are mainly two forms of rabies. It is, one is furious form and the other one is paralytic form. Furious form is the early form of the disease when an individual bitten by a rabid dog, it can be an animal, it can be a human. It starts to show some clinical manifestations that may be in the form of hydrophobia, in the form of photophobia, and you can see the aggressive nature of the animal or the human in this form. And here is the spasm of the pharyngeal muscles, and it is difficult for the animals to swallow. And in the later stage, one important thing to note here is that the animal or human can die in furious form without going into paralytic form. And in some cases, the patient can go into paralytic form when there is the paralysis of the muscles. If you see the current status, some developed nations like Australia, UK, America has eradicated the canine rabies. It means they have eradicated the 9% of dog-bitten rabbit casualties, but still there is rabies, but it is not from the canines. Then where from this rabies is coming actually? If you can see that, as I have mentioned earlier, that the source of the rabies can be bats or other wild animals like jackals or foxes. If you see in the South Asia, there are four categories. It's fully free, occasional like Afghanistan, and medium, where you all know normally that endemic. Endemic nations are those nations where we have the predictable level of rabies infections. So if you see that a medium endemic nations are Sri Lanka, Bhutan, or Nepal, and today we are concerned with the status of Pakistan, Bangladesh, and India, that are excessive endemic nations. Okay, so in Pakistan, you all know in last year, normally in 2019 or the end of 2018, you have seen a viral video from the Sindh, that is the second largest province of Pakistan, that one mother has her child with her and that is dying with rabies. And the people highlighted in the media that it is due to the lack of vaccination. But normally, if you see, it may be due to the lack of vaccination, but the first thing is it is due to the lack of awareness, because the people are not aware to go to the vaccines, and at that stage it is too late to save that individual, because if the patient starts to show the clinical sign and symptoms, then the chances of survival are zero. So Pakistan is that country in which we do not have a comprehensive plan to control the rabies. There are some NGOs which are working on awareness, and they are providing some vaccines and some consultancies, and even some initiatives started to reduce the population of dogs, that is the stray dogs, and in the US is also working in collaboration with Indus Hospital Karachi to mitigate rabies through animal birth control. If you see, there are two main control strategies. One is through the post exposure prophylaxis in human, and the second is to control it in the animals. And in animal, you can control it through mass dog vaccination and the animal birth control. In some countries, like in some instances in Pakistan, the people started to depopulate dogs, and the now research shows the depopulation of dog is not sufficient to control rabies. You have to adopt other strategies, that is like animal birth control and vaccination. So they say that catch a dog, vaccinate it, and then leave it. Because if you are killing the dogs, it is unethical, and the people who are working with animal welfare, they raise serious concerns about this. So the first strategy is community education. The first and the most important is community education, because the purpose of this seminar is to aware the people about the importance of this disease. If you know the importance of this disease, then you will take the steps to mitigate the deaths caused by the rabies. So we all can play our role in mitigating this disease through community education. In this is the era of COVID-19, and you have already seen some videos, some messages on the social media, on the mass media, to how we can control this disease through preventive measures. So in case of rabies, what we can do is to educate the masses what preventive strategies they can take to control this disease. So the one is dog population management, and that can be done through the surgical way, through surgical castration of the dog, or through surgical ovariohysterectomy. So you can say that it is through surgical neutering of the bitches. That way you can control this disease by depopulating the canines. And the other step we need to take is we need to vaccinate our stray dogs. If we can achieve the 70% of vaccination level, normally we can break the cycle of a disease. So that you normally know the concept of herd immunity. One concept is the immunity, it is at individual level, and the other is herd immunity, it is the immunity of a population. If normally the scientists believe that if we can vaccinate 70% individual in a population, then we can break the cycle of a disease. It is not the 70% in all cases. In some diseases, you may need to have 90% of the vaccinated population to break the cycle of the disease. It depends upon the mode of transmission of the virus. So here it is important to take pre-exposure prophylaxis and post-exposure prophylaxis in community. So why pre-exposure prophylaxis, and in which individuals we need to consider pre-exposure prophylaxis? For pre-exposure prophylaxis, we need to consider those persons who are at risk of getting rabies. Who are those persons? These are those persons who are in contact with animals, in contact with virus, who are dealing with the virus. Like you can say that it is the veterinarian who are regularly dealing with these animals, and the lab workers who are working with the diagnosis of rabies, or who are working with the production of this virus that may be used for diagnosis or for vaccine production. And the other strategy is post exposure prophylaxis. So, in which individuals we need to consider post exposure prophylaxis? We need to consider post exposure prophylaxis in all those individuals who are who are bitten by some rabid or rabid suspected animal. So we need to consider post-exposure prophylaxis in all those individuals in which there is a dog bite and there is disruption of our first barrier, that is skin. If the skin is intact, then we can just and do the antisepsis of that place, and we can avoid the vaccination in those individuals. Once this barrier is broken, we need to take the post exposure prophylactic strategies to control this disease. So here you can see the different schedules. You can see that what we have, the strategies to control the rabies. Once you have a patient that is suffering from a dog bite, there are three strategies. We need to keep in mind that there are three strategies. One is that we need to wash that wound, and what we can use to wash it could be soap. It is a virus which is susceptible to soaps like SARS coronavirus 2, and you can use the 70% alcohol solutions. You can use the povidone iodine solution to wash that solution, and we need to wash about 15 to 20 minutes with these antiseptics. And the second strategy we have is active immunization. Active immunization is through vaccines. And there are different vaccines available in the market, and we need to vaccinate those individuals in which the skin integrity is compromised. And when there are three different options, if the individual has no history of vaccination, so we need to vaccine at day 0, and we need to repeat the injections at the given time points. You can see here 3, 7, 14, 30, and 19 days, 90 days. And if the individual, then we have two other options. If the individual has the history of vaccination, then we need to see at what time the individual was vaccinated. If it is within 1 year, so we need to induce just 2 injections at day 0 and day 3. After that, we can discontinue the vaccination. And if the individual was vaccinated, but it was more than 1 year before the dog bite, then we need to give the injection on day 0, 3, and 7. One important thing to keep in mind that we can observe the dog. If the dog is alive after 14 days of dog bite, we can discontinue these injections. Normally, if the dog has saliva, if the dog has virus in its saliva, that means it is going to die within 14 days. Okay, so we can avoid these injections in those cases. And if we cannot see the dog is, it is normally it is through stray dogs, and we cannot observe that dog, then we need to complete this course. And the third strategy, what we have is passive immunization. What is passive immunization? It is the injection of already produced antibodies. It is, as you can see here, it is human rabies immunoglobulins. And we can calculate the dose, and we need to divide it into two. Half of this need to be injected around the wound, and the other half is normally injected intramuscularly. And if the skin integrity is compromised, but there is no bleeding, what does it mean? That the wound is not so deep that there is bleeding. In that case, we can avoid human rabies immunoglobulin injection when there is no bleeding. So I think I can skip this one. So the take home message is we need to work together. It could be the vets, its educators, human who are the key decision leaders, and the media. All the policy makers should be on one page to devise the policy to control the rabies. And it is the perfect case for the One Health concept, which is quite old concept, but nowadays, if you see the COVID-19, all the people from different areas of interest are working collaboratively to find the strategies. Through this way, we can control this highly fatal disease. Thank you. Your question will be welcome. So difference between stray dog biting and normal dog biting and effect of virus. Normally, you cannot differentiate by looking at the wound that whether it was through the bite of a stray dog or a domesticated dog. So what would be the first strategy after bitten by a dog? It would be to wash, to do the antisepsis of the wound. And at the second step, the patient need to be checked by a physician for the vaccine. So the first is the actually to kill the virus at the site of wound, and that is through antisepsis. So what is the best site for injection of the rabies vaccine in a dog, and how many mLs are administered at the site? So normally, for this sort of question, we need to follow the manufacturer recommendations, because there is a particular virus unit, there is a particular level of immunogen we need to administer in an individual. So it depends on the manufacturer in how many mLs they have adjusted that level. So there are various type of vaccines. So we need to follow the manufacturer recommendations for the site and the dosage. So, what are the signs and symptoms of infected persons? We have talked that there are two different forms, and one is the furious form, and the other is dumb form. In furious form, you can have the aggressive behavior of the individual, and you can see the hydrophobia and photophobia and even the aerophobia in that individual. And there will be the drooling of saliva in rabies infected dogs, and there is particular voice of that dog in case of rabies. And in the later stage, there is the paralysis of muscles, and in the end the animal is going to die, or the individual. So there is an important thing to consider while doing a diagnosis in human patients. We need to check the history of dog bite, particularly in Asia. Why I'm saying Asia? Because in Asia, about 99% cases of rabies are due to dog bites. Is it possible to do mass vaccination in Pakistan? Can Pakistan government do this step easily? Yes, it is possible. If you see that the world has done it, we can do it. But the problem is, if our government is willing to do it, right? But it will not be an easy ask to do the mass vaccination of the stray dogs, particularly. The best scenario in our case is to aware the masses, and the second step is to do the post exposure prophylaxis in human. In the third step, we can do the mass vaccination, but it will be a slow process, but it will be worth to do it. There is a question from Kambar Ali Tariq. Why we keep dog who bite someone 10 days under observation while incubation period can be months? The thing is, if there is some dog which have rabies virus in it, normally it's not infectious. We need to differentiate between infectious period and the incubation period. Incubation period is the period from the virus entry to showing the clinical sign and symptoms, while the infectious period is the period from the entry of virus to the start of shedding of the virus. So it's not related to incubation period. So we will observe dog for 10 days, because when the virus reach in saliva, normally when the dog bites, it transmit the infection to other individuals through the rabies virus, which is present in saliva. So when the virus reaches saliva, normally the animal will eventually die within 10 days. So why there are more chances of rabies in dogs, not in other animals? Yes, it's not like that that there are more chances of rabies in dogs. Actually, The other animal can also be transmitted, can also be infected with rabies. But the problem is that the dog transmit this virus through biting. While if you see the bovines, it's not going to transmit. It's normally the dead end host. So that is why we are more concerned with dogs. Yeah, for the link between hydrophobia and rabies, different people have different opinions about this one. So there is one possible explanation is it is due to the difficulty in swallowing because of the spurs and the paralysis of the pharyngeal muscles. The animal cannot drink properly, so that is why they are hydrophobic. But you can have other explanations in literature also.
I would like to thank Sir Farooq for your wonderful and informative lecture. Thanks for your taking time out of your busy personal and your professional schedule, and that means a lot of to being mentor. I would like to thank all the participants to join us today in this webinar, and we hope it will be an informative and productive lecture by Sir Farooq to you. And I hope you all will be eager to join such future events by being mentor. Thank you for your participation.